Hello and welcome back to the IHI channel. I'm Prisca Kweyamba and co-hosting with me is Neema Balige. Now today we have a very special guest who will provide us with insight on an agenda that has been gaining momentum in recent years, and that is decolonizing health research. And this will be a perspective of low-income coming countries. Now we are privileged to have with us Professor Marcel Tanner. Allow me to warmly welcome him. Thank you so much for joining us today. We are humbled.
Thank you very much. It's a pleasure to be back in Tanzania, to be with you and to discuss a really important question.
I believe that there's some people who know Professor Marcel Tanner, but I believe there are also a few people who don't know who you are. So would you kindly briefly introduce yourself? Yeah.
Thank you very much, Neema. To say, I really grew up in Switzerland, and I was always an interest in infection biology and agriculture and culture. And this brought me then to the studies of initially medicine, but without clinics, medical biology and more biology. And because I thought I would be a laboratory scientist. And in 1979, that's 43 years ago, I had the chance after my PhD to really come to Africa. First Cameroon, Liberia, and then Tanzania. I changed basically from the laboratory sciences, but still keeping the background to epidemiology and public health. And this actually exposed me, because at that time you saw that people had many different problems that need to be seen in context, and you cannot just focus on one parasite or one germ role or the receiving role, and that we by all means have really to avoid this word of aid and so just support. Let's just learn together and make a difference.
True. Wow. That was really impressive. I'm learning a lot. I believe, Prisca, you are as well, as well as everybody in the audience. So there are different subjects that are being talked about in terms of challenges. One of them being funding distribution among the global north versus the global south. We have seen that there are issues about scholars getting opportunities, as well as issues around publishing of journals. So people have been mentioning a couple of challenges here and there in those aspects. So what's your take on that?
Yes, I think this is a thing that actually occupies me basically daily now, as in the position as president of the Swiss Academies of Arts and Sciences. This is a big issue. It is not only an issue of the so-called South. It's also an issue of the North. This mutual learning, I said, is actually influencing
from colonization of public health. Now the question I would like to pose to you is, what is colonization of public health, and is it really a problem? Because for so many years, we've never recognized this as a problem. So why is it important for us to discuss this now?
You know, Prisca, this is not just that we have never recognized it. We have always known that we were working in the different cultures and systems with the dominant values of the time this was created. And it is a fact that now remaining in Africa, but we could also go to other parts of the world. I mean, the colonialization has actually led very significantly that the concepts of education and also public health were dominated by the ruling powers, you can say it like that. Because initially, when we were interested in tropical public health, the colonial powers were interested in order to protect their people, their troops and their administrators. And it's only later on that people actually realized, I maybe exaggerate a bit, but that there are also people around that they have to care for, and they have a comprehensive concept. So the result was that the dominant approaches were dominated by the colonial powers, and we can actually see that it is not one way to do that. But if you, for instance, look at countries that have more francophone colonial roots, the approaches in public health are different from the British system. And this is something which it is not just to say that it only came up now, but we can only make an effort by seeing this as a broader cultural issue, not decolonizing public health or global health. We must decolonize our world. I think the basic is that we are actually having respect for the entities that grow, that we are not having concepts that are developed somewhere else, if this is north, south, east or west, but that we are actually create the conditions that approaches in education and in handling, in our case now, health problems, in doing science, are adapted to the situation. And I think this is where we are in the discussion right now. The discussion very often goes into the wrong direction, that people just say, if you change in international organizations a few heads by looking at diversity and putting, let's say, Africans or Asians or whatever into the system, the thing is solved. No. I mean, we have to go back to the roots. We should know where we come from, who has what conditions have really shaped our education and our way on how we do research and so on. So it's this cultural change on one thing, and the respect for others actually that will decolonize, but not just in a very specific subject, but our way on we can learn together. And I've often said it is an effort to make that we must do this process of mutual learning for change. Ever since I had this pleasure and privilege to work in Africa, I said it's not so much who brings what, how much, but the important thing is that we learn together. We learn together in order to make a difference. And if you take this in its substance, then this process will decolonize harmonically. And you don't need regulations and quotas and whatever things. You need a process that people learn to learn together in order to make the difference. And not one, and that's important, is in the dependency role or the receiving role, and that we by all means have really to avoid this word of aid and so just support. Let's just learn together and make a difference.
True. Wow. That was really impressive. I'm learning a lot. I believe, Prisca, you are as well, as well as everybody in the audience. So there are different subjects that are being talked about in terms of challenges. One of them being funding distribution among the global north versus the global south. We have seen that there are issues about, scholars getting opportunities, as well as issues around publishing of journals. So people have been mentioning a couple of challenges here and there in those aspects. So what's your take on that?
Yes, I think this is a thing that actually occupies me basically daily. Now, as in the position as president of the Swiss Academies of Arts and Sciences, this is a big issue. It is not only an issue of the so-called South. It's also an issue of the North. This mutual learning, I said, is actually influencing both sides. It's not just influencing one side. Otherwise, it would be again a dependency situation. Now, the issues of funding, the issues of publication, I mean, is something which, for me, to start with, is a detail. If we do not change this culture that I tried to say before, funding streams will not change. But it has to change from the specific joint projects. And it has to change later on to if we move this upwards. In preparation of this discussion, we had a small discussion at dinner last night, and we were actually remembering the time when we have major donors who were actually wanting to dictate how we are working here in Bagamoyo in Tanzania on the malaria vaccine trial. But you don't change this donor by coming with great principle and so on. You must take a specific example of a specific project, say, you know what? We are not working as you plan to work. We are working together. We have clearly assigned roles and responsibilities. And because roles and responsibilities are assigned, you can change financial flow. And we are not wanting to hear that you always need, let's say, a northern institution that is actually managing a grant and the others have to execute. And I think this is how we change that is if we do not just train people, but we are actually build institution. You see, a place where we sit in Bagamoyo has not been developed to be a site to do a trial, because this has been developed to create a center with an identity that actually can attract projects. All those who continue to get his project funded, they're a grant for a PhD. They remain independency. But if you create these centers of excellence that are actually not sites, not field sites, then you actually create also the power to transform financial flows and so on. And it also then gives you the issue, I mean, that you have at the end a situation by which you don't have a brain drain, but you have a brain circulation. And I think this is very important. I think we don't live in the first world and in the third world. We live in one world. And we are actually needing a brain circulation. That's important. And it's very important that we make experience across systems and culture, because that's transformative. To sit in one place and say what is not good, that could be better, that does not transform. The sharing and comparing across systems and culture is actually the power of transformation. And I think this is how we can tackle this decolonization. I think you should see this in a very practical way. The big thing will change as long as we are at the very basis. We are not accepting that we are sitting here in a site. We are not accepting that we are on the trip of whatever donor, but they are all partners to carry something forward. And you may say this is naive or simple, but if you really look at the work we could do together. And you should also have here also some of the Tanzanian colleagues who really for 40 years have accompanied this process. We could already transform a lot, but it always has the roots in the practical work and not just in the theoretical, high level, low content thinking, you see. And I think this is something which we need to learn. Those who have made this experience, we don't have to discuss if we want to decolonize. We must, because we live in one world. And this is actually a contribution to peacekeeping, to get a better science culture.
Indeed.
Indeed. So you have provided us with your personal opinion on how we can address these challenges, but what has been done so far by the Global North and South to address these current challenges that we're facing?
Yes, I mean, there are many examples, and it would take long, but I think an important thing is out of the, and I really would like to base it on this pleasure I had to work with Tanzania over all these 43 years, up to now, and it continues. But it's out of this experience, and also our experience during my long time as director of the Swiss Tropical Institute and so on, we have actually developed many of those partnerships that were not just partnerships where you have a joint project and collaboration, but we have also developed with the Academy's principles, the famous principles now 25 years ago, and that's why I say it's not only now, on how we work together from the stem of defining the priorities and objectives together up to sharing the benefits you get. These 11 principles we have out of such practical experience were carried up to the level, for instance, of the European community. So the European community, and not only the Swiss National Science Foundation, but the European community assesses projects according to these 11 criteria. And if these 11 criteria, which have, if we would go through, have a very strong decolonization power, if they are really pursued like that, then actually you really make a transformation, and you can see how it has done. So it has been carried to these international, of course, still not enough, but I think it is developing in this direction. But the discussion that goes on at present, where people are just looking how board members should be constituted from institutions and so on, this is okay, you can do that, but that's not the essence. Again, it needs the processes that really transform. And say, for instance, taking the Swiss Tropical and Public Health Institute, my home institution, has transformed thanks to these partnerships. We would not be what we are without having had this partnership with Tanzania, with Cote d'Ivoire, with Chad, with Ghana, with many African countries. And it has helped us to decolonize our institution. And when I could, more than 25 years ago, become director of the institute, then we hardly had any other nationalities than a few Europeans. Not only Swiss, but we had Europeans mainly. When I could hand over into retirement the institute, we had 754 collaborators from 62 nations of this world. And of course, this is a sign that we have tried, what I tried to say before, to share and compare across systems and culture, pick those, and that's a part of brain circulation, because they just didn't come to Basel to retire there. Many of them were spent shorter period, longer period, but would like to go back to act at the place where they come from. This spirit should be there more, not picking. That's colonial. If you pick the good brain and you just place it somewhere. But if you get a process where people are enthusiastic to work together and say, now I have this opportunity to lead a group. So these nations are not only students. We have actually group leader, unit leaders. I mean, if I think of my dear friend Gelacho Cisse, he's from Mauritania, was then working Burkina Faso, then in Cote d'Ivoire, and he is now at the moment in Switzerland. He's a unit leader, waiting to go back to Mauritania. He's not going back very early, it's because of the social political situation. But he would go back. He has never come to Europe just to brain. He wants to bring back things. And I think these processes need to be reinforced. I agree with you, Prisca. It needs not to be done. And many institutions have in the leadership still the thinking that they are knowing what to do and they are helping. And this mindset of help and assistance is not the mindset to transform a society. The mindset to transform a society is respect, doing things together,
Yeah.
unimportant how much one does,
Yeah.
but important that you do it together.
Wow.
Okay, because we're actually live as well, we have a couple of questions online. There's one that asks, in the journey of decolonizing health, what is your personal success story?
The personal success story is that I can sit with you and discuss this here. I mean, that I have had the pleasure and privilege to work in this field over a long time, that actually around here, not in this studio, there are so many dear colleagues from where I could learn so much, more than I could give, and that we are still together and move along. If I think of people who are here at this center, whom I started to employ in 1982, and later on others in 84 and so on, who have then become leaders. For instance, in 84, Dr. Hassan Mshinda, who the Director General of the Tanzania Commission of Science and Technology, he made his way up, and it not only made his way up, not only this Kupanda and Gazi business, but it is also that he could influence a young generation to give on, you see. The most important impact, and if you ask what is your big success factor, is not the numbers of publication. It's no longer the most important impact factor, and that is science culture, is how much you can give on to others.
Next generation.
Because we are now already these old bones, the old crocodiles that will soon die. And so the things what count is not what you just have written. It counts more what you give. And I think that's part of this decolonization, that you really show, here, take it and run. And not just say, these are the guidelines, this is the project you have to do. Then you create dependency. But you must very often say, take it and run. There are some principles that we do good science. We are not activists. We are doing good science. There are some principles on how we respect, in the ethical dimension, a population and so on. But the rest, take it and run. And create these centers from where it can spread. So the success is that we could create not sites where we can do a few experiments, but create centers that live. Of course, we all have our problems also in the north to have always enough fun. But showing such centers and showing the impact that one has. Let's say, for instance, the malaria vaccine development. Let's say the other interventions against malaria. And health system building. With this, you start also to transform the donors. The problem is with the donors. That's maybe a bit hard. It is not that these are old colonials. But you know, most of them, they don't have the practical experience. Because you need to have dirt on your boots in order to make grand plans on how you use money. And I think this is actually the important thing that people often forget with this discussion. If you know what it is all about, because you have practically done it, then you are much better placed to go to these high-level discussions in order to bring experience. We have the donor world and the science community is very often too distant from the problems that the population face and the problems to solve. And if you are closer to that already, you make a huge contribution to decolonization. Look at the corona situation. The corona situation, you had in many countries of the world, you had all these experts. Most of these experts can do wonderful mathematical modeling. But each mathematical model you must put into the context of a society. And if those people, be it public health specialists, whatever the title is, have never practically had to work on an epidemic, then you cannot put a very good knowledge, very good epidemiology into the proper public health context. It's as simple as that. And I think this is where, be it in north, south, east and west, we must make efforts that people have practical experience, that they know how to do. And I think if these people also then finally find also a majority within the donor organization, then we can be much better off. And I mean, if you look at very many ministries and not qualifying a country, very many donors, again, not qualifying, they have the so-called senior manager and vice president, what all this title bazaar is. They have very limited experience in the field. And so that we have seen with, if you have in a development agency, in the classical ones, if you have desk officer, you have been once, 2 years, I don't know where, but then afterwards going for expert missions a few days left, right and center. They cannot grab what it means to work with a community. They cannot grab what it means to have maybe concepts that are not adapted, conducive, that we can be really creative and we can empower people.
Wow, awesome. I really believe that each and every one of us is really being inspired, challenged, but also we are learning a lot from this. One of the great things I have loved from this is that we have room to change the old mindset, the mentality that we are divided, I like the fact that you say that there is no first world, second world, third world, but we are actually one world. And we have to all understand that we should have that mentality so that we can inspire or cause change to happen, from all this aspect of colonization. So I believe there is room for discussion of this agenda, from now. What are the best platforms that you believe will be the best places for us to discuss these agendas? Let's say from WHO or the government forums or all these other forums. What are the best platforms you believe will be the best places to discuss such an agenda?
Every platform that is possible where people have a good intention to really wanting to change something. Certainly it needs to go to these higher global levels, but you also must work on it within your own institution. So for instance, we discuss a lot in the academies of sciences with the Swiss institutions these principles of partnership, which actually is a way towards decolonization. So you have to carry it into the own institution, not just by having in a board an African and an Asian and thinking now we have thought enough, because that's certainly not thinking enough. As well as to do things as you do here in Africa, is really that out of strong centers like the Ifakara Health Institute, you are actually launching this discussion, but keeping it at the level that we must, in a very practical way, work together. Not to float away in theoretical discussions that go into old, wrong dualities of colonies were bad and colonies were good or half good or whatever, but actually really saying, this is where we are now. We have done a few things, but we can do more. But let's tackle this in a coherent way. So an institution like Ifakara Health Institute has to carry this in the broader national discussion. And the start of this institute is to talk about science culture and culture, because the science culture, which then actually also influences our universities in a way. I mean, if the universities still function according to the old models, then you will not change anything. And if, for instance, and then of course it has to go to the ministries and so on, but in a little bit a structured way, and really showing how much you need the different player where science and mainly the translation of science into public health action when we remain is really relevant, because it's this transmission belt of the communication between science and policy and science and society that you need to reinforce. And all the platform, if you ask me where to go, all the platform where this happens, then these are the platforms you must activate. And science to policy doesn't mean you do one experiment and you want to talk with the minister about policy change. Because it must be a iterative process that you are saying, this is the science we do. This science is rooted in a problem of this country. And I think this is how we now must bring this on the transmission belt to the politicians, but also the society. So issues that I mentioned before, Dr. Hassan Mshinda, what they do now with young people, that's important as well, with young people in the city of Tanga, to really have a cultural change in terms of not only science, but also investments you make in businesses and so on, and not just talk about innovation, because that we need, we know. We don't have to reiterate always innovation. But actually you must create the climate for innovation. And I think these efforts, again, that are done in the urban areas or the large urban and peri-urban areas of your country can really be the platforms where you show that. That's how I would progress. I think there are many things launched, but you must intensify it. That's very clear. And then we move.
Okay. So this is just a closing question. So as a former director of an European institute, the president of a Swiss Academy of Arts and Science, how can we know that, or what is the best way to evaluate if this agenda is actually a success?
That you are part of it and you will be made part of it. I think here the Tanzanians are in the international discussion quite well represented.
Okay.
And I think they need to be represented, to continue to be represented. So all those who have an experience, who have dirt on their boots, you see, should be listened more. I mean, here, if you really look at some experience, excellent experience that was made, for instance, in your southern neighbor Mozambique, is not yet so prominent on these platforms. So basically you should work together to have a stronger voice. I mean, it's also across Africa. I mean, there are some important experiences, not only in Ghana, but even in the difficult time in Côte d'Ivoire, also the difficult time in Chad, where some of these concepts come, and alone very often these countries are not yet in a position. So basically it needs more of this. You forget a bit about the north, but you're actually trying to find a better way forward together. I think this is equally required. And also not, I mean, you should not think that, say for instance, just a new player is bringing a new wind. Of course brings a new wind, but it can bring you back to the old colonial spirit. If you think, for instance, of China, if you really look at China, not just numbers, but you look how they carve the contracts with countries. These are dependency situations, as you had in this country for sometimes, even with your African partner, South Africa. I think you are actually there creating dependencies that are not necessary when we want to move together in one world. I think this is in the same way there were these dependencies with the North, also with Switzerland. Also we never had colonies, but we were also partner of countries that had colonies. So we are not just clean. So we all have to bring this together and not just change the northern countries with the eastern countries and think then the world is better. We must create these nuclei of really this mutual learning, this working together, actually here in these centers where we are, and many others.
Yeah. Well, thank you so much, Marcel. Thank you again for taking your time to join us today. It was quite informative and eye-opening, and again, thank you for providing us with insight on this agenda. On behalf of the IHI community, would like to wish you all the best, and hopefully we'll catch up with you very soon. Neema, do you have anything to say?
Well, have been inspired from a personal perspective, and I believe not only I, but many of us have been well informed. We've gotten to know in depth about why this problem existed and what the room that we still have for change. And I believe it begins with us. And thank you for helping us know that, Professor Marcel. It has been quite a privilege and honor having you here. Thank you very much.
No, I have to thank you. And I think it is with us, all of us.
Yes.
And I think the important thing is not just to really theoretically think about it, practically do it, and always do it with enthusiasm. You see, I think we have in many of these discussions in the world, we know a lot, but it is not enough. Concern is not enough. It must be the joy to change, the joy to share, the joy to move forward. Whatever age you are. Thank you very much.
Thank you. Wow. Now, ladies and gentlemen, that was Professor Marcel Tanner. I hope you have learned a lot throughout this session. Thank you very much and have a wonderful day.